strategy as a healthcare system was really to begin to build some infrastructure. We started, like most groups do, as a completely volume-based organization. We understood that the world is changing around us and that there were healthcare systems that were leading the way, and we didn't want to get left behind. And so our strategy was really to begin the value-based component of healthcare in our office settings. So CPC was a wonderful opportunity for us to provide some funding, to build some care coordination, some resources at the clinic level, which we think is really the foundation for our healthcare system. So the strategy was really ideal for us. The hospital system was not ready. They were not ready to change all of the things that have to be changed at a hospital level, but we knew we could change those at a clinic level. And so our strategy was really build the infrastructure for value-based care at the group level, and then expand that up the ladder up into the hospitals. One of the initiatives that we worked on that really engaged the hospital was our relationship between the hospital and our provider group around transitions of care. And one of the things that we really wanted to form a strong connection with was the hospital discharge process. And so we really built a program around transition of care where we brought a couple of transition of care nurses and embedded them at the hospital. We focused on some high-risk conditions, including heart failure and COPD, and we really linked those care coordinators to our offices. I think that's probably been one of the strongest initiatives we've had, because it really gave us a chance to work through a quality improvement process that linked both the hospital and the office-based practices together. And it gave us the opportunity to really get those patients into a primary care office in a reasonable time frame, but in a systematic way, so that we had an infrastructure in place, we had processes in place, and I think after a year's worth of time, we've really seen a big improvement in a connection between the hospital and the offices. And on top of that, we really begin to see some improvement in our readmission rates and our readmission penalty processes as well.
So for the past several years, Hillcrest Medical Center has had a focus on those diagnoses that are marked as high risk for readmission. We've developed patient educational material and a process for finding those patients while they're in the hospital, seeking them out, providing some disease-specific education, and talking to them for at least 30 days after discharge. And during this process, we learned a lot. And then being able to add that to the CPC process, we heard from our patients, so what do I do now? So from the hospital side, the program officially ends at the end of a 30-day period, and the patients still need support. They still need help. They still need questions answered. So we began working with the hospital, the transition care nurses, and the CPC coordinators within each clinic to make sure that patient information and instructions were the same, so that patients weren't getting conflicting information. We also began doing handoffs, sort of like a nursing report handoff you'd see from a shift to shift, and it would be very specific with what questions a patient had had before, what had been addressed, how we resolve those. And we also utilize the same social worker after discharge. So the social worker has a link between the transition care nurses and the CPC nurses in the clinic. And what we have found is that the patients respond to that. They like having the handoff, the next person that's going to help take care of them, and they're not just left to fend for themselves after a 30-day period of time.
Patient advisory councils have probably one of the most valuable tools that we've used across our healthcare system. And before CPC, we really never even considered using a patient advisory council as a tool to improve care. But we initially began with a pilot program in one of our metropolitan